Atherosclerosis. Atherosclerosis is a major reason or a major cause of mortality and morbidity in developed countries, especially related to cardiovascular system. The atherosclerosis is of Greek origin. It means thickening of the intimal layer or the inner layer, tunica intima, of the arteries, and accumulation of fat. That means fatty substance is getting accumulated in the intimal layer of the arteries, the medium to big sized arteries, and these are called as atheromatous plaques. These plaques are the fatty deposits. So it can be defined as a chronic disease caused by deposition of fats, cholesterol, calcium, and other substances in the innermost layer of the endothelium of the large and medium-sized arteries. So mostly it's occurring in large and medium-sized arteries. It's very much similar, or the basic pathology is from arteriosclerosis. Arteriosclerosis means hardening or loss of elasticity of arterioles. They are small arteries. So the basic pathology is similar, but atherosclerosis is a process that occurs in medium to large sized artery, for example, coronary artery or aorta. Hardening of artery is specifically due to atheromatous plaque. A plaque is a waxy substance predominantly made of lipids. Also, there are different kinds of plaques. One is fibrolipid, that's of lipids or fatty, or fibrous that contains of collagen tissue or calcium. Also can be a plaque. So another classification of plaque is stable plaque and unstable plaque. Stable plaque stays there and grows, whereas unstable plaque, it may rupture and it may leave a thrombus into the circulation. So the basic components of a plaque, basically atheroma is the major part. That is the nodular accumulation of soft, flaky, yellow material at center of large plaques. So atheroma is the nodular accumulation of fatty substance in the center of large plaques. It's composed of macrophages or monocytes in which has entered into the circulation. So called macrophages. And following that, there is an area of cholesterol crystals and an outer base which is calcified. So that's the basic component of a plaque. So atherosclerosis consists of two parts basically, that is atherosis or atheroma. That is accumulation of fat accompanied by several macrophages, and sclerosis is a fibrosis layer. It comprises of smooth muscle cells, leukocytes and connective tissue. Uh, these are explained in the pathophysiology. So how these smooth muscle cells and leukocytes and connective tissue etc. arises and appears and gets accumulated, all being explained in the pathophysiology. We'll come to the pathophysiology of atherosclerosis. It begins with the formation of tiny fatty streaks or streaks of fat deposition in the arteries. That means in the inner layer of the arteries. Maybe due to the our daily habits or certain risk factors which have been mentioned. These fatty streaks, tiny fatty streaks, starts appear in the inner layer. The endothelium of the artery is infiltrated by more and more fatty materials as time progresses. For example, what we call as LDL, cholesterol. Cholesterol is an important fatty deposit, that is low density lipoprotein, LDL, or bad cholesterol as we say. It's the protein lipid complex that delivers cholesterols to cells. So when it gets accumulated, it accumulates in the tunica intima. It gets oxidized into ox-LDL. So there is oxidation of protein lipid complexes happening here. So whenever the fatty materials like LDL is being deposited in the endothelium of the artery, it gets oxidized into ox-LDL. So that is the first reaction that is happening, that is oxidation of LDL. And this oxidation of LDL or presence of ox-LDL in that area, it activates the endothelial further. Further, there is endothelial cell activation that is happening. So this process triggers an immune response, and to reply of that immune response, WBC cells get attached to the area, or it moves to the tunica intima, and it is followed by the appearance of monocytes and T helper cells. So these are immune response to scavenge the cells. So when the monocytes, again, it becomes macrophages when it enters the intima, tunica intima. Monocytes become macrophages when it enters the tunica intima, and it takes up the oxidized LDL or ox-LDL, and it becomes form cells, something called as form cells. So a form cell is basically a macrophage which is containing a lipid. Then a macrophage has taken up an ox-LDL and it has become a form cell. So basically a macrophage containing lipid is a form cell. Presence of this form cell is a major factor that is the reason of formation of a plaque. So these form cells, again, it initiate migration of smooth muscle cells from tunica intima, from tunica media to tunica intima. These form cells, it initiate migration of smooth muscle cells. So smooth muscle cells are found in, again, tunica media, that is the next layer of tunica intima. So this form cells, presence of these form cells, it initiates migration of smooth muscle cells from tunica media to tunica intima. Proliferation of smooth muscle cells again leads to increased collagen production. Collagen is nothing but protein, collection of protein which is necessary for body buildup or tissue buildup. Whenever collagen or protein is present, it binds, it holds the parts together. So it leads to hardening of the arteries. These form cells later they die off, and when they die off, it releases the lipid which was inside it, and also its DNA, and even that also accumulates in the endothelial lining. So all these smooth muscle cells, or what we call as form cells and dead cells, lipids, dead DNA. So all these are accumulating together and contributing to the formation of the atheromatous plaque. Yeah, apart from this, other materials are also deposited in the lining, including salts of calcium and other minerals, and cellular debris, as I told, the dead macrophage cells like that, of varying composition. So all these accumulate together and initiate an inflammatory process in that area. And this inflammation, it causes further vitiates the reactions going on there, and further inflammation means further accumulation of immune response and further accumulation of WBC and monocytes and macrophages appear in the area, and the process goes on as a cycle. So this causes the initially tiny lesions, it enlarges and it thickens to form atheroma or atherosclerotic plaques. And these plaques, as it grow, it may narrow the vessel channel, leading to obstruction in the flow of blood. That is ischemia, again ischemia, the part which it supplies. And later it may rupture. What happens is that the plaque, in an advanced stage, the plaque, it may rupture. And when these, as I mentioned, all these debris and all these smooth muscle cells and fatty deposits which are inside the plaque, when it get advanced, the fibrous cap of the plaque, it ruptures, and when it ruptures, there is some kind of injury that is happening, and it initiates some kind of clotting or coagulation process. This coagulation process leads to the formation of a thrombus or a blood clot in the area, and this thrombus, it then grows and it obstructs the blood flow completely, leading to a severe tissue damage. This thrombus, it can stay there, or it can get detached from that place and gets into the circulation and flows with the blood and reach in smaller arterioles and gets obstructed there, forming a thromboembolism, leading to ischemia or infarction of that particular area. So in this diagram, you can clearly see the formation of an atheromatous plaque in the endothelium or the tunica intima of the artery. So the colored violet color is the tunica intima layer, and there is a presence of formation of a large lipid core that is in yellow inside the tunica intima, and next to it is the tunica media and the outer tunica adventitia. So as I have explained, the large lipid core, it consists of, you can see it's oxidized LDL. That is the lipoproteins which are getting oxidized, ox LDL, and it also contains apoptotic macrophage. That means dead macrophages. So dead macrophage cells um, and also T cells. So all these are present in the large lipid core, and in the thin fibrous cap that is shown in violet, you can see there are infiltrating monocytes and macrophages which keep on infiltrating and enter in the plaque or the inner layer. So the infiltrating monocytes and macrophages are present, and all of the smooth muscle cells which are appearing from the next layer, tunica media. It is also present in the thin fibrous cap, also the extracellular matrix or the collagen, etc. protein, which is the reason for hardening or binding of all these factors together, leading to the hardening of the wall. So this is basically the structure of an atheromatous plaque. I'll explain one more point regarding a feature. In the advanced plaques, that is in the center of an advanced plaque, we can find a necrotic center. So what is that necrotic center? It means usually we can find macrophages or OX-LDL, which are macrophages with a lipid in it. Usually after a time, macrophages, it dies off. Then that process is called as apoptosis. And these dead macrophages is cleared from time to time by a process called as efferocytosis. Efferocytosis, it's a type of phagocytic engulfment again by active macrophages. These dead macrophages are being cleared off by phagocytosis, and that is called as efferocytosis. And this efferocytic clearance of apoptotic cells, this rapid efferocytic clearance of apoptotic cells, it leads to suppression of the pro-inflammatory response. As I have told, there is an inflammatory response is the main reason of the plaque being advanced or all those cells being accumulated, and this rapid clearing, if the dead cells are being cleared in between, there is a suppression of that pro-inflammatory response, which can lead to a slow growth of the plaque. But if the efferocytic clearance is lacking, then the inflammatory response more and more, and dead cells, more and more dead cells is accumulating and leading to a faster growth of uh, plaque. So in advanced lesions, the apoptotic macrophages are not efficiently cleared by efferocytosis, and the apoptotic macrophages or dead macrophages that accumulate eventually, it undergo secondary necrosis. These accumulate, these dead macrophages not cleared off, and it accumulates, and it undergoes secondary necrosis, or it gets swollen. It's a swollen dead cell debris. It is also being accumulated. This buildup of necrotic debris, again, it promotes inflammation, instability of the plaque, and acute thrombosis. This point holds importance. I had mentioned two types of plaques, that is a stable plaque and an unstable plaque. The size of the necrotic center is the main factor that determines the importance of plaque being stable or unstable. I'll just explain what is a stable plaque and an unstable or a vulnerable plaque. So stable plaque, as you can infer from its name, it is stable. With more stable means the rich extracellular matrix or the collagen present or the fibrous cap all are rich or thicker, and more smooth muscles are present. But the necrotic core is minimal. So the plaque is hard and it stays in that position and grows. Okay, that is the stable plaque. You can see in the diagram it has a thick fibrous cap and a large extracellular matrix component and a low number of macrophages because it's been cleared in time to time, and a small necrotic core. Whereas an unstable plaque or a vulnerable plaque, it is having a weak fibrous cap and a large necrotic center. So large necrotic center means the more and more dead cells are being accumulated in that area, and it leads to further inflammation in that area. So high macrophages are also present, and it's prone for rupture. And when it ruptures, it exposes the thrombogenic collagen to circulation, and a thrombus is being formed there as a result of a healing or a coagulation that is happening. And this thrombus can occlude or either occlude the artery or detach and get away and gets lodged in some other area. Usually it affects larger arteries, coronary, renal, femoral, carotid artery. Anyway, it can occur. It can produce stenosis, means narrowing of the artery, and ischemia, that is lack of blood supply to the particular area, and it can either produce a stroke. See, if the carotid arteries are involved, it can lead to the stroke. If the coronary artery, it can lead to a myocardial infarction. If the renal artery is involved, it can lead to a renal infarction. So if the femoral artery which supplies the limbs, it produces a peripheral arterial occlusion disease, peripheral artery occlusion disease. It is called as and it's called as PAOD. And one of the main symptoms in PAOD is claudication. Claudication, as I explained in the ischemia chapter, that is pain or cramping in the lower leg due to inadequate blood flow to the muscles. And it's usually felt while walking or movement, and it subsides with rest. So that is the sign when this atherosclerosis affects in the blood supply to the lower limbs. Claudication is a main feature. So I'll just mention a few risk factors that are involved in the progression of atherosclerosis in a particular individual. That is, first one is the unhealthy cholesterol level. So you have to check your good cholesterol or bad cholesterol. What it says low density lipoproteins and high density lipoproteins. The low density lipoprotein or LDL cholesterol is more, there is an increased chance of atherosclerotic plaque formation. And another factor is a high blood pressure. Your hypertension is again considered as a trigger for the atheromatous plaque to occur. Smoking is also another risk factor because it doesn't allow the oxygen to reach the body tissues, and it can also deposit nicotine or something like that, and nicotine and leads to the hardening of the blood vessels. Diabetes is also considered as one of the risk factor, and obesity and lack of physical activity. These two goes hand in hand with a unhealthy cholesterol level and a high blood pressure in the person. A lack of physical activity, it can lead to formation of deposition of fat in the arterial endothelium. In older age, so genetic or lifestyle factors can cause the plaque to build up in arteries as with the age progresses. So in men, the risk increases after 45, and in women, usually it increases. The risk age is after 55. Then family history of early cardiac diseases. So if there is your father or a brother was diagnosed with a heart disease before 55 years of age, or your mother or sister was diagnosed with a heart disease before 65 years of age, it can increase the risk of atherosclerosis in you. Again, stress and alcohol is a very common trigger for heart attacks or cardiovascular diseases, where emotional involvement is also present in stress. And heavy drinking, it can damage the heart muscles, and again it can contribute other risk factors. Heavy drinking and improper diet along with heavy drinking, it can lead to unhealthy cholesterol level again. So all these are also one more factor is that the high CRP and high triglycerides. CRP is nothing but a C-reactive protein. It is high levels of CRP, it is present. It's an inflammatory marker. It's a sign of inflammation in the body. So when CRP is high in the body, and it may be due to any kind of inflammation, again there is a chance of triggering of the formation of atherosclerotic plaques in a higher rate. Also high triglycerides. So triglycerides are those deposits of calories, so those extra calories which our body doesn't need, that is being stored in the form of triglycerides. So accumulation of triglyceride is an important trigger for cardiovascular diseases, and atherosclerosis plaque also can be formed easily by a high concentration of triglycerides in the body. So initially, the presence of this atherosclerosis plaque or formation, or the process of formation of this atherosclerosis plaque inside the arteries will be clinically silent, or there may not be any clinical features for that. Because the fatty deposits produces certain kind of enzymes by which the artery or the arterial walls accommodate, it enlarges and accommodates the plaque in it initially, and we will not be aware of the stenosis or the narrowing of the artery happening inside till late. And last 2 points is, one is thrombus and embolus, because I'll be continuing with thrombosis and embolism in the next chapter. So I'll just give a definition, or give a basic idea of what is a thrombus and an embolus. So thrombus is a solid mass of platelets or fibrin formed locally in a vessel. A solid mass of platelets or fibrin. It may be due to a small endothelial injury that I have explained earlier in this chapter. Maybe the tip of a plaque that has ruptured, leading to coagulation and formation of thrombus. Another example I have written is atrial fibrillation. Fibrillation means irregular heartbeat or irregular rhythm of the atria is called as atrial fibrillation. When atrial fibrillation occurs, the walls, the rhythm of the atria is improper, and there is no proper output of the blood. So pooling of blood occurs in the left atrium, and pooling always results in a formation of thrombus. When blood pools, it starts coagulating. It's not flowing, it's just stagnated. So there's a chances of formation of a thrombus. Also in mitral and aortic valve diseases, also there is improper cardiac output happening due to improper functioning of the valves. There are also pooling or stagnation of blood is there, leading to formation of thrombus in the vessel. Embolus is a piece of thrombus. It can be a piece of thrombus or a plaque or a piece of fat or an air bubble when carried towards other areas by bloodstream. It gets stuck in a narrow artery. So from a bigger artery, a piece of thrombus or a plaque or a fat or an air bubble, which is carried towards other areas by the bloodstream, and when it gets stuck in a much narrower artery, it produces ischemia, complete ischemia to that part of the tissue which that artery is supplying. So that is called as embolism. The process is called as embolism, and that piece of substance is embolus. And when specifically it is a thrombus, it is called as a thromboembolism. When a thrombus become an emboli, it is called as a thromboembolism. The details of this will be dealing in next chapter.